All right, some of the programs, let's talk about what changed over the years. There's some highlights. So we're going to start off with what we're really excited about and then some things we're not excited about. But we already talked about the higher rates across all the fee-for-service programs. That's definitely a thumbs up. There's some new codes with lower thresholds that'll make it easier for you, particularly RPM and RTM. There's some codes that will allow for fewer days of readings and fewer than 20 minutes. There's an expansion of an APCM program, adding behavioral health to the mix, giving you new opportunities. We think that's a good opportunity. And then Geo 136, this is a social determinant screener. It's kind of changing. We think it's changing for the better. And so Kathryn's going to share her thoughts on that. Our limitations, what we wish made the final cut but didn't. RTM, remote therapeutic monitoring, is still limited to musculoskeletal and respiratory conditions. We were hoping that 2026 might be the year where they make it more generic and allow all conditions. But unfortunately, that didn't make the cut. And you still can't do RPM and RTM together for the same patient. We definitely see the scenario where you could have a patient with a blood pressure monitor for RPM and a pill box for RTM getting medication adherence. But unfortunately, we'll have to wait another year because that won't be in 2026. But all in all, I think it's a good year. These four updates that we'll talk more in depth about, I think they're going to add a lot of value and something we should all be happy about. So first off, what programs stayed the same? So for those of you who are doing chronic care management, principal care management, transitional care, general behavioral health, chronic pain management, advanced care planning, no major changes across the board other than you're just going to get paid more for doing them. So you don't have to change your workflows. These programs will operate just like they did in 2025. Now, there are some programs. We'll get into details in a second. RPM has some changes, RTM. AWVs are staying the same except for that HRSN section, the social determinants, and we'll tell you what you need to know about that. And then APCM is staying the same, but now you have some new add-on codes that are available to you if you choose.